Hello, my name is Pauline RN. Welcome to my channel. Today we're talking about pharmacology and I am on part 3 of pharmacology. My first question, I am going to ask you to hit the thumbs up button. Please subscribe to my channel. Please share this video with your classmates. I am going to be doing questions and answers from RN NCLEX examination. My first question, when do we give patients one-time medications? The correct answer, we'll give patients one-time medication, for example, pre-operatively. Patient is going to surgery and we may have, when patients are going to surgery, they are NPO, nothing to eat the night before. But in the morning, they'll ask us for some patients to give a one-time pre-operative antibiotics IV when the patient is on their way down to the operating room. So pre-ops is an example of one-time medication. The next question is, what do you know about oral medications? The correct answer, oral medications are the most desirable way to administer to the patient. Oral medications are the easiest way, most convenient way, it's safe, and above all, oral medications are less expensive. What do you know about enteric coated medications? And the correct answer, never ever 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 crush enteric coated medications. Never ever crush sustained release medications is the correct answer. How do you administer eardrops to adults? Correct answer, you pull the ear up and back is the correct way to administer eardrops. How do you administer eardrops for children is the next question. For children, correct answer, you pull down and back. What are antitussive medications? Correct answer, these are medications for cough. What are antacids used for? Correct answer, antacids are used for stomach ulcers, stomach acids. GERD is the correct answer. What is the use of anticoagulants? Name some anticoagulants. Anticoagulants prevents blood clots. Excuse me. Anticoagulants like heparin, aspirin, Plavix, Coumadin, these are anticoagulants. Prevents blood clots, DVT, thrombophlebitis. Your antipuretics are used for what? Correct answer. Antipuretics are used to prevent a fever, control temperatures. Example, aspirins, antipyretic. Why do we administer anti-anxiety medications to our patients? Correct answer, we administer anti-anxiety medications to our patients who are anxious, confused, restless. Tranquilizers, Ativan, Aldol. Where does metabolism of medications take place? And the correct answer is the liver. If you are running IV medications, the doctor gives you 1,000 IV medications to hand, and you are running back. You're running behind because you may start with one IV bag in the morning, and by midday you find out that you're running 4 or 5 IV bags. There's a lot of things going on with your patients and you're running behind. What should you do? The correct answer, if you're running behind, do not play catch up. You can harm your patients. The correct answer is notify your doctor is the correct answer. What is the most frequent side effects of medications? The correct answer is nausea, vomiting, dizziness, constipation, itching is the correct answer. Most frequent side effects. Next question. Your patient is on vancomycin and your doctor is ordering a TROUGH level. TROUGH. What does that mean to you? TROUGH level is a blood test that is taken before the 4th dose of IV TROUGH antibiotics is administered to the patient to see if the level is too high. If the level is greater than 20, you will hold the medication. You will not give it to the patient. You will notify the doctor. So your patient is vancomycin and antibiotics. The patient has received 1 dose, 2 dose, 3 dose. Before your patient receives the 4th dose, after the 3rd dose, you have to draw the patient's blood to see what is the vancomycin level in the blood. We call it a TROUGH. We will send it to the lab. When we get the result, we take a look at the result. If the TROUGH level is greater than 20, we will not give the patient the 4th dose. We do not want to overdose the patient. Notify the doctor. So a TROUGH level is given, is drawn, it's a blood draw before you administer the 4th bag of IV vancomycin. Next question. What should you do concerning abbreviations for your medications? Maybe you're documenting in your nurse's notes and you're running late, you want to go home, and you just start throwing all these abbreviations in your nurse's notes. The correct answer is follow your facility rules. Follow your hospital rules concerning documentations using abbreviations. What do you know about medication reconciliation? Is the question. Correct answer. Medication reconciliation, it's a list We write the patient's meds, a list of all the medications the patients are taking at home on admission. The dose, usually it's oral. If it's once a day, twice a day, bedtime, we have PRN. We have to write out all the medications the patients are taking at home. That's a medication reconciliation form we will complete. If the patient has the medications with them, you can look, because sometimes the patients are not reliable. So if you look at the pill bottle, you can look at it and make a list of all your medications and send home all those medications with the families. You don't want the patients to overdose, them taking it at the bedside and you giving to them a second time. If there's no family, just lock them away in a safe place. So included in your medication reconciliations are dietary supplements, and vitamins are also documented. Inhalers, whatever inhalers those asthma patients are taking, we put them, because inhalers, that's also medication that's is prescribed. They get them through the pharmacist. Okay, what do you know about opening your ampules? Correct answer: when you're opening your ampoules, wipe it, clean your ampoules thoroughly with alcohol, with gauze around the mouth of the ampule, or alcohol or gauze around the mouth of the ampule. Just snap off the top of the ampule backwards away from you to open the ampule. That's the correct answer. What do you know about drug allergy? The correct answer: drug allergy affects the immune response. Drug allergy occurs when the body interprets medication as foreign, is the correct answer. Next question. Your patient is admitted. You admitted the patient, and the patient said, well, you assess them, you ask them, do you have any allergies? The patient say, I'm allergic to penicillin. What do you do, is the question. You will put an allergy bracelet on the patient's arm and document that your patient is allergic to penicillin. Some patients have 5, 6, 7, 8 different type of allergies. You have to place that information on the allergy bracelets and document those allergies. Next question. What does anaphylactic reaction means to you? What is an anaphylactic reaction? Correct answer is life-threatening. It causes respiratory distress. Assess your patients for bradycardia, bronchospasms, cardiovascular collapse. Next question. What is a teratogenic drug? Correct answer: a teratogenic drug has potential to cause developmental defects in embryos or fetus, is the correct answer. Please thumbs up. Please subscribe to my channel. Please share this video. Thank you. Stay tuned to part 4 for pharmacology. Thank you.